Since we're talking a little bit about informing, clients and the population in general, I'm going to link up a couple of questions from Georgina here, and would like to know your thoughts with regards to how neuroscience can help us combat racism, misinformation, and disinformation. No matter how you define those, and we're not putting a political spin in these whatsoever. But how do you see the role of neuroscience informed sort of approaches or communication supporting clients and the general population in that way?
Yeah, so I'm in the States, so this year everything's political, but I will refrain from politics. It sounds like there's some multiple dimensions to that question. So I want to give it the respect it deserves, even though there's a few layers to it. I think that there are some basic brain-based principles that we can operate from as clinicians that can help us understand kind of the course of bias and how to regulate it in ourselves and in our conduct with others. So, for example, our nervous system, our brain tend to be very gullible. They'll believe anything we tell it. And so this is sort of a play on cognitive behavior therapy, but it is true that often we start with narratives and then look for evidence to support those narratives. And that's related to the second principle of how our nervous system works. And that is our nervous system prioritizes safety and survival over accuracy and over connection. So if there's room left, we'll connect. But really what we're trying to do is survive. And so it's a lot more. And so the third principle there is that our nervous system values efficiency over accuracy. So we've got safety and survival over connection and speed over accuracy. So we are designed to make snap judgments based on limited information for the sake of survival. What happens, though, is when we do this, we start treating those snap judgments as if they're based in reality when they're really just based in biology. And so I think neuroscience and the neuroscience of bias and in-group, out-group bias and stigma really informs how it's really hard to get away from the way we're biologically wired. And so what that means in working with others is you can't really fake being empathic or connected to people, even though there are beliefs out there. Some people behave as if they can fake it, but the other person's nervous system is always scanning for threats as well. And so I think once we know that, it opens the door for us to have maybe more candid conversations, more room for some grace toward ourselves, grace toward others, and again, hopefully move toward more transparency in our communication. So I think that's just one dimension of the question that was asked. So if there's another level that I need to address, I'm happy to circle back.
I think that's good, and I think that also illustrates the importance of, there are certain areas of knowledge that as a therapist is really important for you to be across, even if it's at a basic fundamental level. So one of these is neuroscience, precisely because of what you just said. Understanding some basic concepts of neuroscience, some rules and how the brain works, really informs a lot of things in other areas, including our own ability to maintain a certain perspective with clients and act in a way that serves their interest and not being overly biased, because you're always going to be biased to an extent, but you need to learn how to manage that and recognize that, and then recognize that in clients as well and others around you. And I think a similar other area of knowledge is addictions. There is a common misconception that, in order to really learn about addictions, you should be working with clients with addictions, and that's kind of a specialty areas. But if you don't have some fundamental knowledge of how addiction works, especially in the brain, then you can't recognize the difference between a mental health disorders and addiction, or how there is an interplay between those things. So there are really some areas, and I'll say addictions and neuroscience are two of those that are really fundamental, and understanding the fundamentals of it really help you develop a more informed perspective across, any client you work with or across any area that you're going to specialize in.
Yeah, that's a great point. This is so. If I can just jump back to this idea that neuroscience validates our existing theories. Knowing how the nervous system functions, we can be better equipped to walk within the experience of the individual rather than using the cognitive and social shortcuts that often we use to be more, again, efficient. Remember, we're biased toward efficiency and survival, and when we, as a society, we have to make these shortcuts to be able to scan the environment really quickly for threats. But when we're in session with clients, we have to make that transition that there is not a threat present in the same way as maybe if we encountered someone out in the world outside of the session. And that means that we can be more patient and take more time to explore with them their experience of a phenomenon and lay aside some of the shortcuts that we would normally have. And the research is pretty clear about addiction stigma and how even professionals who believe in the medical model, who believe that this is an organic issue, can still have high levels of bias and stigma and low levels of empathy, even when they know the science. So anyway, yeah, I appreciate you bringing up that. We can talk more about that too.